Hello, my name is Aaron Arias. I'm your clinical educator. This is a quick video about the different types of central lines. There's basically four of them: tunneled, CVCs, implantable ports, non-tunneled CVCs, and PICC lines. This first picture shows tunnel catheters, and there's the different types. Of course, a single lumen Hickman, the triple lumen Hickman or Broviac, and then the Groshong tunneled central venous catheter. This is a picture of where they go. Where they end up is here in the superior vena cava. See if I can focus that. They can be inserted either IJ, subclavian, or femoral. And they're usually for long-term central venous access. They require a surgical insertion, but can be done at the bedside through local anesthesia. They do have a lower rate of infection compared to other central venous catheters, and we'll go over the other three. Next slide is on implantable ports. Implantable ports are inserted in the subclavian or internal jugular vein, usually subclavian. They're tunneled beneath the skin, and their actual port is subcutaneous, and it's accessed with a non-coring needle. These are really long-term type central lines. As you can see, it's under the skin there, and you use a non-coring needle to access that port. Usually these are really good for cancer patients. Next slide would be on non-tunneled central venous catheters. Again, these can be implanted percutaneously into the IJ, subclavian, or femoral. These are more for short-term access, usually for emergent type of dialysis. And here we show a picture of a elite dialysis catheter. Same thing here, they're inserted in those three places that we mentioned, but they end up there in the superior vena cava. Lastly, we have the PICC lines, peripherally inserted central catheters. Here's some different types of power PICCs and Groshong. They are usually inserted into the basilic or brachial or cephalic veins, and again they enter into the superior vena cava, as you can see there. These are short-term to intermediate. You see a lot of these when we just can't get peripheral access any other way, or somebody needs to go home on long-term antibiotics, that type of thing. They can be a little difficult to position in that central vein, and there is a potential for occlusion, but they do serve a really good purpose for not having to actually use the typical central lines that have higher risk of infection. One more type is really just showing the different dialysis catheter, the Hemosplit. It's a dual lumen, and again that can be inserted subclavian, enters through the superior vena cava, and as you can see on this one goes into a little bit further. But those are the four different types of central lines. If you have any questions, give me a call. My name is Aaron Arias. I'm at 26531, and my cell is 281-979-5592. Thank you.